Hi friends, welcome to my channel. Today we are going to see about sepsis. Before we moving to today's topic, I would like to request you please like, share and subscribe my channel. Plus please write it down in a comment box that what all topics you would like to know, and then we can take or we can have that sessions. Sepsis, definition of sepsis is a dysregulated host response to infection leading to a life-threatening organ dysfunction. Causes of sepsis are due to bacteria, streptococcus, staphylococcus and Escherichia are the responsible. From the virus group influenza, coronavirus and RSV, and fungi group candida and aspergillus. So what are the risk factor involved for the sepsis are very young age, like below 1 year old, very old above 75-year-old, community or people with the immunosuppressed like cancer or AIDS, HIV, recent surgery, people who have the intravenous drug uses, people with the indwelling lines like a Foley's catheter, IV lines, they are more prone for infection, sepsis. Breach in skin integrity, example any of the pressure ulcer, any wound, they are more prone for sepsis. What is the pathophysiology behind the sepsis is sepsis starts with an initial infection typically caused by bacteria, but it can also be caused by virus, fungi or any other pathogens. Infection can occur in a various part of the body such as lungs, urinary tract, abdomen or bloodstream. Then what happens when the body detects an infection, the immune system responds by releasing inflammatory molecules to fight off the invading pathogens. This immune response is intent to protect the body, but in sepsis it becomes dysregulated and excessive. So in sepsis, the immune response becomes widespread and systemic, affecting the entire body. The inflammatory molecules released by the immune system trigger a cascades of events that can lead to widespread inflammation and organ disinfection function. The inflammatory molecules cause blood vessels to dilate and become more permeable. This leads to decrease in a blood pressure and impairments in a blood flow to vital organs such as heart, brain and kidneys. Due to impaired blood flow and oxygen delivery, multiple organs can become dysfunction. Organ dysfunction can lead to severe complication and can be life-threatening. What will be the sign and symptoms? Client may have a fever and hypothermia, tachycardia, tachypnea, hypotension, changes in mental status and urine output may decreases. Management will be, remember, BUFALO. B stands for blood lab test and blood culture. Urine output we have to monitor. Fluid monitoring, administer antibiotics, lactate infusions, and then oxygen as required, or patient may require a intubation, so we have to intubate. So this all about the sepsis. Please like, share and subscribe my channel and stay tuned for more topics. Thank you very much for listening. Bye bye, take care.